Hello friends, today we are discussing the topic structure and uses of head and toy. Head and toys are structured related to the barbiturates, but it's divide of 6 oxymoiety and they are cyclic monoacyluria and are weaker organic acid than the barbiturates. The structure of head and toys are given here. Head-on-toin phenytoins are the two main constituent of the drug which are used in the pharmaceutical industries for the as barbiturates. Uses of these drugs are it can be also be used in the treatment of all types of epilepsy and for trigeminal neuralgia. Epilepsy are the neuro disease. In that treatment, barbiturates are generally used. It is useful for the treating the cardiac arrhythmia. It is useful for the treating the cardiac arrhythmia, especially induced by digitalis. Side effect: dizziness, itching, skin rashes, vomiting, with the blurred vision, tremors and fevers are the side effects of these barbiturates. What is meant by CNS depressants? CNS depressant means central nervous system depressants. The drugs which have the depressant actions on the CNS, its principal pharmacological actions is known as CNS depressant. There are two types of non-selective CNS depressant. These are drugs which produce a generalized depressant action on the central nervous systems. They include the hypnotic, sedatives, general anesthetic, central muscle relaxants. Selective central nervous system depressant. Those drugs which selectively depress certain region or portion of the central nervous systems are known as selective central nervous system depressant. They include tranquilizers, analgesic, anticonvulsants. Next is the explain the term pharmacodynamic agents. There are terms, general terms used in the drug chemistry. Some are the pharmacotherapeutic agent, pharmacodynamic agents, CNS stimulants, hypnotic sedatives. Various other agents are used in the drug chemistries. These are the drug pharmacodynamic agents are the drug which acts on the various physiological function of the body. Pharmacodynamic agents are the drugs which acts on the various physiological function of the body. They are further classified as follow: non-selective CNS depressant, example hypnotics and sedative; CNS modifier, example tranquilizers; CNS stimulant, example antidepressant drugs. Generally, the CNS means the central nervous systems. Central nervous system is the main control room of the body, and peripheral nervous system contains the periphery of the body. But total command of the body is controlled by the central nervous systems. So central nervous systems, they are command receiving and order releasing centers. Every command and every sensational nerves conduct the impulses from the overall body and transfer to the central nervous system, where it is analyzed and decide the actions, reverse action against these impulses. So these are the actions and against actions of the body. Next one is a CNS modifier, example tranquilizers. CNS stimulant, example antidepressant drugs, adrenergic blocking agents, histamine, antihistamine, local anesthetic, cardiovascular agent. Next term is the LD50, medial lethal dose. LD50, lethal dose. This is the dose expressed in the milligram per kilogram, which will be expected to kill one half of the test population of the same species and strain of bacteria or animal. Minimum dose to cause the death of the 50% of the test population is called LD50. Minimum dose to cause the death of the 50% of the test population is called the LD50. This dose in general is known as tolerance or threshold dose. This is all about the today's. Thank you. We'll discuss next topic in next lectures.